one of the biggest game changers for people with mast cell is digestive. And because it's a multiphasic digestive enzyme that helps every step in digestion. I'm just going to tell you guys right now that part of what helps when you think about all the food that's presenting as allergens is that the bigger the food particles are, the more allergenic, allergy irritating they are. So when you actually digest the food properly, it means you're breaking it down to smaller and smaller particles. When you break them down to smaller and smaller particles, they are lower and lower to no longer allergenic. And yet, most of the people with mast cell, histamine intolerance, allergies, eczema have a digestion problem in the first place. And that's why they have tons of allergic symptoms. So that's just put in a nutshell why taking something like a multiphasic digestive enzyme that has minimal number of ingredients that covers every step of digestion is really critical for people with mast cell or histamine intolerance. So I'm going to ask our guests. Several of you mentioned digestion. Who can really speak to how big was actually understanding and dealing with digestive problems a game changer for you?
Dana.
I know, you see me nodding. It
Yeah.
was everything for me. I mean, I could say that prior to coming into the program, I knew I had digestive issues. I had like chronic SIBO, gut infection for quite many years and went on multiple rounds of antibiotics trying to treat gut infections. And I had, this is lovely to say, but chronic diarrhea and constipation, like a mix of the two. My digestion was terrible. I weighed less than 94 pounds. Like I couldn't gain weight for the life of me because like I just wasn't breaking down food to actually absorb the nutrients. And so I was in a real predicament. And then once I started digest it, it took about 2 weeks, but I started to notice that I was having weight gain and that I, was having my symptoms of abdominal pain removed. And, ultimately that helped with my histamine related symptoms as well. And I still take Digested to this day. I know that that's the supplement that's my real win. And I notice when I don't take it that I do have less of a flow, if you will.
Hi, I'm Maggie, UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. And all 3, I think, of our panelists lost a ton of weight in the middle of these giant flares to the point of almost scary, life-threatening level of weight. And that's from poor digestion, high histamine, poor tolerability, and then poor absorption of nutrients. Laura, can you share a little bit about your experience with your digestion wins?
Yeah. So, I mean, I had common variable immunodeficiency and was on plasma infusions for years. And I've since been able to come off of them, which is lovely and wonderful because I've been taking biofilm buster and vitamin A and all the things. But, our immune system lives in our gut. And I had chronic issues with diarrhea and just a lot of stomach pain and discomfort for years. And really certain foods that, of course, I didn't realize were my body rejecting them. But what I also realized, I ended up losing my gallbladder in the middle of, or not long after I joined the program, actually. I think I lost my gallbladder, and it's just because all of that had built up over the years. I mean, it had been going on chronically for years. And to be able to have the combination of digested and ox bile was a game changer. At first, I just took digested for a while, but then I realized that taking one digested and one ox bile was really my sweet spot.
Mm-hmm.
And I never had any digestive symptoms after that. I mean, it was just easy.
I mean, you hear that time and time again. And once people start getting a handle on their digestion and they're taking these supplements like you're mentioning, we had that comment up just a moment ago that first pill of Digested, and it was like, the world changed.
And like I had chronic nausea for years, chronic nausea. I mean, every single time I ate, I would be so sick. And I said to myself, well, they told me that was the autonomic neuropathy because it's my autonomic nervous system that is responding and getting activated every time I eat. So every time I ate, I would feel extremely nauseous. I would have to eat mints and take supplements and all of these things. And really what I realized was it was a digestive issue. So when I had the digested, it was like, that was just gone.
Dr. Maggie, why is it that when you go to the allergist, no, they're not talking to you about digestion at all?
They have no training in digestion, right? So, I mean, logically, just think about this, everybody, okay? We just mentioned digestion having to be a major trigger of increased histamine reactions, right? And then histamine reactions triggers all sorts of other symptoms. You go to the allergist, and the allergist is trained to do blood or skin tests to identify IgE anaphylactic allergies only. They have no training in GI gut. And I'm going to tell you right now, you go to the GI doc and they have no training in digestion.
That's criminal, because that's, I mean, you're really going to there for help with that system, and yet they can't offer much in the way of that other than probably testing, we'll do a scope.
We'll do a scope. Oh, yeah, it looks fine. But the thing is, digestive breakdown, your cell lining might look fine, right? But it's a functional problem. If you can't break down the food and they're presenting in bigger allergy pieces, they're more allergenic. That's the problem. You may go to a GI and say, is it my digestion? Is it irritable bowel syndrome? They scope you, might look normal. And then they're like, I don't know what to do with you. So people are going ping-ponging from specialist to specialist, playing whack-a-mole. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire, and that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.